Hello everyone, good morning and welcome back to another episode of Kidney Care with Omotayo. My name is Omotayo and today I want to make an appeal post, like I want to specifically talk to NHIS. Over the time, NHIS always covers 6 sections of dialysis, which I believe is never enough. I'm not saying you are not trying, I'm not saying you are not good at what you do, but I want to sincerely appeal that you can do better than this. The 6 sections were actually fought for by the Nigeria Association of Nephrology, and since they fought for that 6 sections, it hasn't been reviewed yet. 2017 at Ife during the NACOF conference, that's Nigeria Association of Nephrology conference, the former Minister of Health then mentioned to us that the past Minister of Health mentioned to us that the government, the NHIS, will have to, from 6 sections, will cover 36 sections of dialysis. 36 sections, and we are happy. We clapped, we were so happy, all of us, the nephrology experts, the doctors, the nurses. We were so happy about this development and we couldn't even wait for it to be implemented. Furthermore, the minister said that for any patient that has his or her dialysis done here in Nigeria will be entitled to immunosuppressants. That's the post-transplant drugs, the anti-rejection drugs, and we are so happy. But it's been 5 years now. It's been 5 years and I want to cry. And this has actually not been implemented. That was in 2017 and this is 2022. That was even in February. It's even more than 5 years now. So tell me, if NHIS still covers just 6 sections of dialysis, sometimes with package of 50%, for instance, if a section of dialysis goes for 30,000, the patient will pay 15,000 and the HMO will pay 15,000, and still with this 50% package, the NHIS cannot cover more than 6 sections. Literally, what NHIS is trying to imply is that once you do 2 sections, 2 weeks of dialysis, because in a week it's expected that patients have 3 sections for them to live a normal life. So if for a week you use your 3 sections and the second week you finish your 3 sections, that's the end of your life. No, come on, I believe we can do better in Nigeria, because truth be told, the treatment of kidney failure is not what someone, a civil servant, can actually bear alone. And for somebody that is actually health insured, a lot of times people are not even assessing their package that they've actually will I say, I won't say that they were defraud or fraud from or something. But a lot of times people don't even assess this package. Some people from their own pocket, they spend their money on their health. What is something they are actually capable of doing, like going for medical checkup or some many things. Couple of days now, I met a woman who supposed to see a doctor, a cardiologist, and was like, she has not even used her package NHIS since she has, and this particular person works with government, which they've always been deducting her money for NHIS. A lot of people don't even access these NHIS packages, and at the end of the day, when there is now need for it, NHIS will not be able to be there. No, it's so wrong now. Kò ṣe nǹkan tó dáa, sincerely. I want to just appeal to NHIS that please, from these 6 sections, you can actually review it. If you cannot review it to make it that 36 sections as said by Professor Adewale, you can increase it to something reasonable. You can increase it to 15. At least do something. I mean, 2 weeks in a year. That means after 2 weeks, you are expecting this patient to die. And truth be told, there is high mortality for people suffering from chronic kidney disease due to inadequate dialysis, because it's not easy. It's pocket draining, and oh God, it's not easy. Let me just put it that it's not easy. NHIS, if there is a way that you can actually come through for this patient, please do something. Please do something. Please do something. We were happy 5 years ago when the past former Minister of Health announced to us at IFE during our now called Nigeria Association of Nephrology, when he announced to us that they will increase to 36 sections. We were happy, and thereafter he moved on to even tell us that for any patient who has had transplant in Nigeria will actually benefit from immunosuppressants. We are happy too, because at the end of the day, patients that have undergone transplant spend a lot of money on the drugs as well to keep the kidneys safe, to keep the kidney not to fail. So please, NHIS, if you cannot even go for the immunosuppressant, which I know that you will not be able to cater for that, can you please review the 6 sections of dialysis? I'm begging, like, I'm actually on my knees, like, ẹ dákun ẹ jọ̀ọ́, please, can you actually review these 6 sections of dialysis? Is nauseating, like, it's making me to have heartache, is making me so uncomfortable. Just 2 weeks ago, there is a patient like that was actually enjoying the 6 section. He never knew that the 6 section would soon expire. He was diagnosed of end-stage renal disease and required the renal replacement therapy, which is dialysis. So he was able to source for funds and put a central line. And over time, we just come, I want to do dialysis, we make posting, we go for clearance, we make posting, we go for clearance. And it is 3rd week, he came, he wants to do sections as usual. And after making the posting for this procedure, getting to NHIS, they sent him back that he has exhausted his package, which is 6 sections. This is a patient that is just diagnosed, like a patient that he hasn't even spent 1 month. And now 6 sections, the NHIS package has finished. I don't know, but Nigerians, I don't know how you can actually help, because only one person's voice cannot actually do anything. My voice cannot do anything. I'm just making this post for the public. Is there a way we can help these people suffering from kidney failure, at least especially people that are actually insured? Is there a way they can benefit from this health insurance of a thing? Because I remember in abroad, you always make reference in abroad, this, that. At the end of the day, they remove money for our NHIS and people are not accessing their package. In abroad, what actually keep patients like that, what actually keep patients undergoing a critical illness is because of the health insurance. Yes. In abroad, health insurance, once you are diagnosed of CKD, in fact, ambulance will even go and pick you in your house if you don't show up, because you are already insured. They give you the erythropoietin, they feed you, they make you feel comfortable, and you will not look like you are sick. But reverse is the case in Nigeria. Even when you have your health insurance, you are still not accessing it. Like, come on, what is 6 sections of dialysis? I'm getting angry. Like, it's making me to get angry. But please, I don't want to be angry. I want to beg you. NHIS, please. I want to beg meaningful Nigerians that they should look into this thing. Anytime I see my patient, wailing and lamenting, I feel so heartbreaking. I don't have much. I will have been doing the charity, of course, for them. But where is the money? But the little they are deducting for them, or what they've deducted from them, can it be refunded when the need comes for it? Please, NHIS, I'm begging you, I'm begging you, like, see me, I'm on my knees. Please, I'm begging you. I'm on my knees. Need that. I'm on my knees. NHIS, please come to the help of people that are in need of your services. I'm pleading on behalf of my patient, renal patient. Please kindly review the 6 sections. 6 sections is not enough. 6 sections is not enough. 6 sections is not enough. Please kindly do something, sir, ma. Kindly do something, sir, ma. Thank you in advance as I listen to a favorable consideration of this video, because I actually made a tweet and it's not going viral. So please help us. Thank you.